Hey parents, this video is only for you. You may not want your kids to watch it with you, but we want to make sure that you have all your questions answered about any appointments that are coming up in our practice. Hey y'all, my name is Amy Morgan and I am the marketing coordinator at Pediatric Dental Associates and Orthodontics. And in this video, we are going to be telling you exactly what you need to know if your child is having their first appointment for a filling or a stainless steel crown. So you come in for your regular routine dental cleaning and the dentist has told you that your child has a cavity that now needs restorative treatment. Whether they have told you that they need a filling or a crown or possibly even an extraction, we want to make sure that you know exactly how that appointment might go in our office. Usually the dentist is not going to explain these procedures or how the appointment might go while your child is sitting next to you. So we've created this video to give you some insight and some answers to some of your questions. In our office, for most procedures, we recommend that the child have nitrous oxide, which is also known as laughing gas. This is completely safe for children. We use it in small doses and we are monitoring them constantly throughout the appointment. One of the reasons why we want to do this is try to reduce the anxiety of your child during the treatment. But also, there's a little bit of a secret that goes on while the nitrous is being given to them. They are actually given it to them through a nose piece that will actually block their vision from being able to see the tools or anything that is happening beyond their eyesight as they are laying down on the bench. By blocking their vision from being able to see these tools and other things that are happening, it does also reduce the anxiety of the child. Now, once the nitrous nose is placed, we will leave them on this nitrous oxide for approximately 10 to 20 minutes, just depending on how long it takes for them to get acclimated to it. At some point during that 15 to 20 minute time frame, the dentist or one of our highly trained hygienists will come in and actually be able to give them the injection that is needed to numb the area and get it prepped for treatment. To prep the mouth for the injection, the dentist or hygienist will place a topical anesthetic. This will start getting that part of their mouth a little bit numb on the top side so that the initial injection does not cause as much pain. Once that topical has had a couple of seconds to sit, they will then do the injection. The injection is placed at different sites depending on the type of treatment, where the tooth is located, and how long the tooth needs to be numb for the treatment. After the injection is given, we will then wait another 5 to 10 minutes to allow the numbing to take place. At this point, the dentist will then test the area to make sure that that area is numb. Once that area is numb, they will place something that we call a mouth prop. This is an item that is used to hold the child's mouth open so that they can relax and bite down on that instead of actually having to use their muscles to keep their mouth open during the length of time of the treatment. After the prop is placed, depending on the type of treatment that is needed, the dentist may then need to use an isolation technique. This can be used by something we call the isolate or the rubber dam. All this is doing is isolating that tooth away from the rest of their mouth to reduce saliva and other items getting into that area. And it also allows for the dentist to be able to see that tooth clearly and be able to work on that area as quickly as possible. After the isolation device is placed, the dentist will start using their hand pieces, or as we know in the adult dental world as the drill, to be able to clean out the tooth decay. Once all the tooth decay is cleared out, the dentist will then place either a filling or a crown, depending on the type of treatment that was needed and the severity of the decay. Once the treatment is completed, the dentist will also make sure that your child's bite is still correct and that everything is still in line so they will have no problems chewing for the longevity of that filling. Once the dentist has completed all of the treatment, the child will then be given a certain percentage of oxygen to be able to kind of flush out the nitrous oxide out of their system. They will stay on this for a few minutes as they get acclimated back into a normal oxygen level. Once that process is completed, Then your child has completed the treatment appointment and they get to get a prize and you get to relax. At the end of this appointment, the assistant should provide you with aftercare instructions that should have answers to anything that may happen at home so that you have a cheat sheet to be able to take care of your child while you are not in the dental practice. Once you are done with this treatment, if you have additional treatment appointments, we usually like to schedule those approximately 2 weeks apart. And we want to make sure we get all those on the book as quickly as possible. But once all of the treatment is completed, we want to make sure that you have your 6-month cleaning scheduled at that time. A few suggestions that we have going into this type of appointment is, number one, make sure that you are not projecting your own adult dental fears onto your children. Try to eliminate telling stories about your childhood or other dentist appointments that you have had that have caused pain or that have made you fearful of returning to the dentist on your own. Number two, if your child is one of those children that tend to cooperate a little bit easier and a little bit better without you in the room, then please feel free to stay in the waiting room during the procedure. We promise we will take great care of them and return them and give you all the instructions that you need to take home. And number three is to ask questions before the treatment starts. If you have any questions or any concerns about the cavities, the placement of the treatment, the placement of devices, or anything else that you might think that would come up and you need to ask the dentist, please feel free to do so prior to the treatment appointment starting. This video does not include every single nuance that could happen during the treatment appointment. This is a basic overview of a standard operating procedure that would happen for a child for a treatment appointment. We want you to know that we can always adjust our procedures based on your child's cooperation, as well as any questions or concerns that you may have as a parent. Again, if you're watching this video and you have a question right now, you can type it in the comments below. You can also email me directly at amy@smilesarewild.com or call our office at 479-582-0600. All of our staff is trained to answer these questions for you, and if we don't have the answer, we can definitely get it for you.